One type of social phobia occurring primarily in Japanese culture is called Taijin Kyofusho and is translated as a disorder of fear. It is seen as an individual's intense fear that his or her body, its parts or its functions, displease, embarrass, or are offensive to other people in appearance, odor, facial expressions, or movements. Taijin Kyofusho centers on concerns about embarrassing others with one's presence rather than embarrassing oneself in the presence of others. This disorder is believed to emerge out of a childhood history of social inhibition and shyness. It may abruptly follow a stressful or humiliating experience, or its onset could be more subtle in nature, with the lifetime course of the disorder usually existing on a continuum. Taijin Kyofusho is a disease foreign to Western society. This kind of society tends to be individualistic and see the pursuit of personal goals as a sign of psychological health. In cultures where the group is seen as more important than its individual parts, social anxiety disorders manifest differently as people often become increasingly distressed about how they may affect others. The crucial difference between Taijin Kyofusho and social phobia is subtle. Social phobia focuses on the fear of embarrassment in front of others, while the Japanese phobia focuses on being afraid of embarrassing others by being in their presence. Symptoms of Taijin Kyofusho. A person may be diagnosed with Taijin Kyofusho if they feel as if their attitudes, behavior, and physical characteristics are inadequate in social situations. As a result of these feelings, they also experience persistent suffering in the form of emotional distress through shame, embarrassment, anxiety, fear, and other tense feelings when confronted with social circumstances. In addition, individuals also worry about being unable to maintain healthy relationships with others. When it comes to socializing, Taijin Kyofusho sufferers avoid painful social and interpersonal situations, while simultaneously being averse to doing so. In the official Japanese diagnostic system, Taijin Kyofusho is subdivided into the following categories: the phobia of blushing, the phobia of a deformed body, which is similar to body dysmorphic disorder, the phobia of eye-to-eye contact, and the phobia of having foul body odor, similar to olfactory reference syndrome. Although Taijin Kyofusho is primarily a mental disorder like most anxiety disorders, there are also varied related physical symptoms. These include blushing, rigid facial expressions, inappropriate eye contact, offensive body odors, appearing disheveled, sweating profusely, trembling hands, voice, feet, and uncontainable flatulence. Prevalence of Taijin Kyofusho. Typically diagnosed in adolescence or early adulthood, Taijin Kyofusho affects 10 to 20% of the Japanese population. Clinical data indicates that more males have the condition than females, despite the fact that females scored higher on a social phobia scale and report higher scores on embarrassability than their male counterparts. This differs from Western society, where the prevalence of females with social phobias is to some extent greater than that of the males. The lifetime prevalence of the disorder falls anywhere between 3% and 13%, with changes in severity occurring throughout one's lifetime. Treatment for Taijin Kyofusho. Psychological treatments include elements common to cognitive behavioral therapy, including relaxation training, systematic desensitization, cognitive restructuring, rehearsal, and skills training. Central to this is the idea that the conceptualization of treatment is a key element in the understanding of the disorder itself. Morita therapy. Morita therapy was developed by Masatake Morita in the early 1900s. The procedure includes pragmatic guidance in the acceptance of the patient's specific symptoms and an attempt to direct the individual's energy from their previous concerns, such as somatic symptoms, to the present. The first stage consists of isolated bed rest, where the patient is not allowed to have visitors, read, or have conversations. This helps them learn that anguish eventually leads to deliverance. The second stage is more active in that a patient can engage in light work and is assigned simple chores like writing in a diary under a therapist's supervision. In this stage, the patient is also allowed to engage in reading such things as classical poetry. However, they are still not permitted to speak to others. In the third stage, the patient is given heavy work with minimal guidance while being prohibited to take free walks or engage in other forms of entertainment. The fourth stage consists of attending lectures and meetings where they are exposed to arguments toward learning to accept themselves and their symptoms in an attempt to move towards engaging in constructive activities. Morita treatment has since been modified to include outpatient and group treatments. The modified version is known as Neo-Morita therapy. After completion of this process, depending on how closely the protocol is followed, treatment response has been noted anywhere from 78 to 93%, which shows that sometimes the answer to a problem is simply critically thinking about it. Medical treatment. Medications are also used to treat Taijin Kyofusho. One study indicated that milnacipran may be helpful in the treatment of the disorder. Milnacipran is the first in a new class of antidepressants that boost serotonin and noradrenaline levels. However, more studies must be done to verify its efficacy. Another study involving paroxetine, or Paxil, and psychoeducation was effective in reducing offensive social anxiety, as well as improving patient insight into their fears regarding offending others due to their particular physical functions and appearance. Thanks for watching this video. If you enjoyed it, please give a like and subscribe for more videos like this one.